Hello, everyone. Part 3 Psychotherapeutic Drugs lecture. Mood stabilizers and ADHD are the two drug categories we will be talking about. So let's just jump into it. There's nothing to it but to do it. Drugs used as mood stabilizers. So there's many drugs. The staple drug is going to be your lithium, and then there's some other ones from that are used in conjunction with or as an alternative to the lithium. And again, as far as definitions go, please, again, refer to your DSM-5 and your ICM course. Like I mentioned, lithium is going to be your staple medication. It's good and bad in the sense that it's great, or rather it can be great for people and be life-changing to help with their mood disorders. But then it also has issues with toxicity, adverse effects, and then compliance. So it's not the greatest drug in the sense of as far as like its adverse effects and stuff are concerned, but then it can be, like I said, kind of life-changing for some patients. So it is still used a lot. It's an older drug, and like I said, it's kind of a messy drug, but it is something that you definitely will still be seeing out in practice, I think. One of the reasons it's kind of a difficult drug is because it does have a narrow range of therapeutic serum levels, otherwise known as a narrow therapeutic index, or NTI. And all that means is that you have to kind of custom tailor the dose to the patient, and it's based off their lab values. And so that narrow therapeutic index just basically means if you don't dose enough, you are subtherapeutic, and it's not treating the patient. It's not effective to treat the patient. But then if you dose over that narrow therapeutic index, or that window, if you dose over it, then you just have toxicity, and it's too much toxicity and too many adverse effects. So this one can work pretty quick, up to a week before it can start working. Mechanism of action. So as far as its mood stabilization, it is one that is not fully elucidated. They don't know exactly why it works, and like I said, other than it just can be life-changing as far as it can be very beneficial for your patients with a mood disorder. Uses, we talked about this already, bipolar disorder. So it is going to a lot of times be your first line. There's some site-directed uses as well, so please read through those. Typically not going to be your first line choice for things like a headache, migraine cluster headaches, and then for SIADH. Adverse effects. So unfortunately, these can be seen at therapeutic serum concentrations. So like I said, you have that narrow therapeutic index that you're shooting for, that's window, but you can see these adverse effects. So please make sure you are putting a star by this slide. I want to make sure you know this for my exam. You have fine hand tremor, dry mouth, weight gain, some GI adverse effects. And again, those are all even at therapeutic levels. And then definitely if you are supra-therapeutic, or you're above that narrow therapeutic index. More adverse effects. So polydipsia and polyuria, hypothyroidism, sexual dysfunction, nephrotic syndrome, leukocytosis, EKG disturbances. So you'll start seeing now, again, why I'm saying it's a messy drug, lots of adverse effects to consider. The other thing, too, is that these can be pronounced, all of the adverse effects and the toxicity of lithium can be pronounced with dehydration. So that is something to be mindful of. And especially in your hotter climates, so especially places like South Texas or San Antonio as well. We had to, make sure you're counseling your patient, make sure they're staying well hydrated, because, again, basically these adverse effects can become more pronounced with a person who has dehydration. And you'll note, too, these can cause polydipsia, but polyuria. And so can then maybe add to that and just kind of make things worse. So something else to note. Alternatives to lithium. So we have kind of a grab bag as far as what these drugs are. Carbamazepine is an anti-seizure medication. Clonazepam, benzodiazepine, so an anxiety medication. Valproic acid, another seizure medication that may be beneficial. Lamotrigine, another seizure medication, may be beneficial. Olanzapine, we saw, antipsychotic medication. And this one has a little note on it. It is preferred in patients whose dominant mood swing is manic. So this is for people who have more mania. The olanzapine may be, and again, in combination, sometimes with lithium as an alternative. Maybe they're on a couple of these. They're on, they're on Lamictal and Klonopin, maybe. It's, again, this is going to be kind of the art of medicine here, and I believe on your psych rotation you'll be kind of getting more exposure to that as far as why you would pick one over the other for a particular patient. Summary table, as always, please look at the clinical applications, adverse effects, and the contraindications. Common side effects of anti-seizure medications. I included this here because I thought it would be good for studying purposes. And specifically, you can just highlight the ones that are used here. So we have the carbamazepine, like I said, valproic acid, lamotrigine. So let's go down here. So we have carbamazepine up here, lamotrigine right here, and what was the other, Tegretol? What was the last one? Carbamazepine, lamotrigine, sorry, is right there. So those are ones that you should pay attention to, this side effects and neurological side effects. But I included the whole chart here because valproic acid, valproate is the other one there. That's the one I was forgetting, sorry. Is because you can see some of these other ones sometimes being used for mood disorder, and this is definitely prescriptions. So for example, if someone comes in with a lamotrigine prescription, this is definitely one of those where I would want you guys to write, so best practices, to write on there, it is for a mood disorder or it is for seizures, because again, if not, it's just kind of a guess and we're not sure. And the dosaging can vary depending on your indication, etc. So anyway, so for this table, just please pay attention to the drugs that are mentioned before. And again, we have them: lamotrigine, valproic acid, and carbamazepine for your systemic side effects and neurological side effects. And then we have the rare but serious side effects of these anti-seizure drugs. So again, carbamazepine, lamotrigine, valproate. So hopefully that helps you guys for studying. Switching gears here a little bit, we have attention deficit hyperactivity disorder, ADHD. Some medications listed here. So in 2018, the American Heart Association issued a statement that all children diagnosed with ADHD who may be candidates for stimulants have a thorough cardiovascular assessment prior to initiating of drug therapy. So please note that, and this is specifically for your stimulant medications. First off, for the stimulants, we have the amphetamines. So we have the brand names here, just again, because these are referred to by their brand names a lot. But for testing purposes, just memorize these. CNS stimulants, and these will help with ADHD, narcolepsy, and they can maybe help for obesity. Because all of these will, they suppress appetite. And even when you're not trying to have weight loss, they can cause weight loss, even in your ADHD patients. Next up, we have the methylphenidate and dexmethylphenidate. Again, these are also stimulants. Similar to amphetamines, a little bit different as far as their organic chemistry is concerned, or their structure. It can be used for ADHD and narcolepsy. We have bupropion, which we talked about already, being an antidepressant, but this one has an off-label use, and it may be beneficial either alone or in conjunction with other medications for ADHD. STRATTERA, so this is a non-stimulant. It's the first non-stimulant approved for ADHD. And because of that too, I believe Dr. Poss will be going over with you the controlled status of medications and controlled substances. So please refer to her lectures for the specifics on that. But your stimulants, your Ritalin, Focalin, Adderall, Dexedrine, Vyvanse are all C2 medications. So those are ones you cannot write prescriptions for as PAs. But you still will be managing patients who are on those. However, bupropion is not controlled, so you can write prescriptions for that for ADHD. And then also STRATTERA is non-controlled, and so you can write a prescription for that. PROVIGIL, Modafinil, I believe is controlled, but it's not a C2, so this is another one, you guys. Another ADHD medication that's working on the central adrenergic receptors. And then we have NuviGil. This is a newer medication. Exact mechanism of action, not fully elucidated. This can be used for ADHD, narcolepsy, obstructive sleep apnea, and then shift work sleep disorder. Summary table here. Again, please look through this. Clinical applications, adverse effects, and contraindications, as always. And then this is an FYI, but I thought this was interesting and relevant to you guys and your rotations. These are some resources for families of children with ADHD. So this is definitely something you could would probably want to share it with your patients, your future patients, who have children or adolescents who are suffering from ADHD. So that is it for this presentation. This was a quick part 3. I'm kind of surprised I already got here. But anyways, thank you guys for your time and attention. I appreciate that very greatly. Thank you. And as always, make sure you email me if you have any questions, comments, feedback, other things, or if you feel like something's missing, or I don't know. You guys have had a lot of great feedback, and I try to take as much of it as I can, and so I appreciate that as well. And then your future classmates, future generations appreciate it, because I think I'm making things better for the next year, so that's always nice as well. So they thank you as well, right? So no, we're all connected. All right, so thank you guys. I'll talk to you later. Bye.